From my point of view, there's typically three primary parts or three primary issues that causes developmental delays in some fashion, okay? It's not all autism. Usually there's either a genetic issue, okay, that comes about, or we'll find some form of an insult to the brain or the nervous system, whether it's coming in because of a health issue or a baby shot issue or whatever the issue is. The brain doesn't care. The brain recognizes it as an insult to the system, and if it hits at the wrong time, it'll interrupt the developmental process, the developmental unfolding. We can look at our classic milestones, which are hugely important, okay, because those are specific goals that we need to achieve. We can also look at it in terms of what's called a dimensional perspective. We can looking at, within the brain itself, we look at the auditory system itself, independent of the milestones, where it has a very specific growth pattern and developmental pattern that it should go through. Interesting thing from my point of view is that not only is it a milestone, we also have a rate of growth that it achieves. That timeline, okay, not only does it knock the child off the milestone achievement, but also the rate of growth itself. We can actually, instead of having a slope that looks like this, we can find it being slower. So actually, may actually go back a year or two, okay? It's not unusual, for example, for me to see a child who's 6, whose their developmental age is actually 3. And so that's looking at knocking off the timeline altogether. But also the rate of growth of those different dimensions of the brain, okay? Instead of being a normal age appropriate or accelerated, we start seeing it actually being slow and sometimes even flat. Because I've seen some kids where they may be 3, 5, 6, but there are certain systems that are 18 months in terms of maturation. That particular part of the brain itself, if it's at 18 months or 2 years, okay, it's going to impact the unfolding the rest of the brain. So one of the things that's important from a developmental point of view that we actually measure those brain systems, okay, from an age perspective as well as a development perspective to make sure that they're all age appropriate and also growing and maturing the rate they're supposed to. If we find one that's not there like it's supposed to, and we know for a fact it's going to impact down the road certain parts of the brain's maturation, which you're going to see in terms of behavior or learning issues or learning inefficiencies or all sorts of things, okay? So our job is to identify those areas of the brain that are not developing both at the rate it's supposed to or age appropriate, and then see if we can find a way to influence it to get back on the developmental timeline. Most often we can, and in the process we can help them reach their full potential.